Jamie, I'm so happy to see you today. I'm Dr. Lauren Mathewson. I'm here with Dr. Jamie Kunkle, and we are doing a sort of test run of our first podcast recording. I've known Dr. Kunkle since 2018 when we worked in a clinic together. It was fall of 2018, I think.
Yeah,
And we worked in that clinic for until when?
I left in May of 21.
May of
So
21, and stayed peripherally in contact since. And I miss so much the conversations we used to have in the clinic, especially when you and the rest of the team used to have journal club meetings and I would come crash your journal clubs. Yeah, you guys would have a Lyme journal club, and it was just so interesting what was going on that I'd worm my way in, and I miss that. And that was such a fun time. Well, what an amazing team we had, but also it was so rich and it was so cool to learn so much from one another. I feel like everything I know about complex chronic disease, I learned from Dr. Anderson and from being around you. And I know enough about complex chronic disease that I don't dabble in the infectious side of it. I leave that to folks like you. And I love to have you as a referral source. I send you folks all the time.
thank you.
Yeah, yeah. And in fact, maybe as just a little bit more of an introduction to my relationship with you and the trust level I have with you is that I recently had a young patient show up with his mom. And I know you've met him, young dude in college, and all of a sudden got really sick, had to pull out of school, and was nosediving, right? Energy dropping down to the point where fatigue kind of getting to the point where it looked like he was going to be really debilitated quickly. And mom was kind of doing this, like interviewing docs who knew about Lyme and other complex chronic disease thing. And I didn't mean to scare her, but I got real serious with her and I threw the brakes on, and I was like, listen, if this was my kid, there is one person I would have him go see. It's Dr. Kunkle. He has a wait list. Get on it. I'm going to text him right now, because I remember that kid from the first clinic we worked at who he showed up in a gurney. He was not walking before he started working with you. 6 months later, dude was up out doing miles a day. So I've seen a lot of complex chronic disease docs manage their patients and keep them from getting a lot worse, but I don't know a lot of docs that turn things around the way that you do. So that's my sort of little endorsement for, not that you need more folks on your waiting list. And pardon, that's my new puppy. That is Ava in the background. Kind of going way back, if you were not going to go into medicine, what were you going to do?
Oh, that's a really good question. And before I answer that, first of all, it's a pleasure to be here. Thank you so much for helping to organize this. I've known Lauren for, how many years now, since 2018. And she says, she doesn't work with the infection side, but she works with the oncology and cancer side, which is also really complicated and important work. So next week, I'll probably interview her and talk about that. So just so you know, also very important. So it's been a great collaboration. So going back to my journey, where I started, where I all began, it's a good question, because I'm not really sure if I knew I was going to be standing here talking about this right now. I wasn't even really entirely sure that the science world was for me, but I ultimately made a decision. I wanted to learn more about the brain. So my undergraduate was in neuroscience, and I think that started with, weirdly enough, my interest in plant medicines and strangely, like psychotropics, even stuff like caffeine. I was like, why does caffeine make my brain feel weird? Stuff like that. And so I was just trying to understand entheogens, is what they call them, or like how plants affect our brains. And that kind of led me to just want to understand, well, how the brain works, because there was just really so much about the nervous system that I didn't understand, and that we still don't even understand today. So that curiosity started me out. And I was pre-med in the University of Pittsburgh. My home state is Pennsylvania. And I had encountered a lot of other pre-med students, and they didn't really seem to show a lot of interest in plants and stuff like that. So I was kind of like, I don't know if I want to go into traditional medical school here. So like, maybe I'll try research. So I went in to hang out in some of the research labs. I hung out in a neuroscience lab and a microbiology lab, and I kind of realized that life was a little bit lonely, too. There was a lot of pressure to publish, to get funding, to get grants, to do all this stuff all the time. And I really commend the people that have dedicated their life to research. I mean, it's a very hard game, and it can be lonely at times, I think, and very competitive. I mean, it's a hard world. So I kind of pivoted a little bit, and it was kind of my last year, even when I was graduating. I just realized that there was another type of medicine out there. There's just another way to do things, and that was naturopathic medicine. And I looked at it, I looked at the program, and I was like, wow, this actually looks like it's pretty intensive. It's a very science-based program. There was a 4-year medical school. They do all the basic sciences. They have the cadaver lab. They do all the normal stuff that you would do, except that they have these extra classes in natural medicine, philosophy of medicine, in terms of how to approach cases, how to heal people, treating the whole person. They classified the doctors or physicians more as healers versus, just practitioners or people that were, maybe dictating or controlling the whole narrative of the visit and the journey for people. So it was more time spent with people. So it just was really alluring to me. So I kind of made a last minute decision. I only applied for one school, weirdly enough, and that was Bastyr, because I really wanted to go to Washington. I've always been just enamored with the Northwest. And I'm even back in the Northwest now after being in California, because I just love the Northwest so much, which I'll get to sometime. But what I did, I went there, and then I started getting interested in acupuncture and Chinese medicine, and I went into all that. I learned all the Chinese herbs, and it was just an amazing process. And so, yeah, that was kind of where I went with it. And I don't know, I can't imagine being anywhere else, really. I think research would have been my alternative possibly, but can't imagine a better profession right now.
Beautiful answer. I totally resonate with that. Kind of leading into my next question, and I ask this because my family, it's taken them a while to kind of figure out what I do. Does your family, do they understand what you do?
I always have to ask that. I mean, I think yes and no. I think they have some idea, because what's happened over the years, though, is naturally with naturopathic medicine or with conventional medicine, if we're really interested in learning and integrating, we sort of like move closer to each other a little bit. So I think the process of being out there and practicing, I've moved a little bit closer to some of the language of conventional Western medicine. And
Yeah.
I can sort of use that to have a familiar discussion and conversation with them. So I think in some ways they might think I'm just sort of a slightly greener end of allopathy or conventional medicine at this point. I don't know if they entirely know the depths of what I do and sort of how I do it. They just know I treat really sick people, and I kind of put a natural spin on it, I guess, in terms of herbs or something. So I'm not really sure if they really know, honestly. I've chipped
I
away over
love
the years.
I love that. I know they're proud of you, I'm sure, but it's funny because in my family, there's sort of there's some question marks around what I think everyone thinks I do especially on a kind of day-to-day basis. I wanted to ask, I was so interested in this. When you're analyzing a case, I know you have that framework of the Chinese medicine training. How often are you pulling up and using those frameworks? And how often are you kind of thinking or weaving in that? Because I asked this, the colleagues that know both you and I, sometimes we chat about you and we say, God, how does Kunkle stay just a little bit ahead of where we all, like, how does he always have that little extra, right? And so I think about this and I think about you, and I've asked you this before, and I know you kind of mentioned just that you chat with a lot of people and you stay very current with what's going on in the research. But I was wondering, do you feel like your Chinese medicine is also a piece of that picture?
It very well could be. It's hard for me to really compartmentalize. I think I would have to say that it's probably just sort of a part of me that's integrated.
Yeah.
And I think the real value in it, it's pattern differentiation is like sort of the term that they use. And it's just to try to take complexity and distill it into actionable steps. And even starting with diagnostics, and even the diagnosis being very related to the etiologies or causative factors. So it's like this diagnosis due to dot dot dot. So it just amplified the framework of the naturopathic model, and which was a step above the the conventional Western model, I think, as far as all that goes. And that just, I think it's just something I sort of naturally pull from now, but it does help me very quickly discern patterns, things that are meaningful. They say as we continue to learn too, that our sixth senses, like our gut feeling on things, I think there's an article that just came out about that. Maybe we'll have to discuss it in one of these podcasts, because I find it to be a fascinating thought. And I feel like I've really cultivated that. I have to always check my work, and I'm very sort of self-critical on it, but my brain quickly discerns patterns. And I think that the Chinese medicine was really useful for that.
Yeah.
And that really helps me even in looking at Western research or talking to people or kind of getting the crux of what's important out of a discussion or out of a paper or whatever, and really just integrating it. So I really do think it helped a lot. And it's probably more than that. I'm just saying, because I can't really compartmentalize it at this point. I've just been too deep.
I
And
understand it's impossible to like pull that framework up and
yeah,
out, but
yeah, it's hard to say. I would have to do like a study on myself and my brain and the process
yeah.
that brought me to this point.
For example, I know when you're taking on new patients or even when you're seeing return patients, you do a big comprehensive physical exam on them. And I know you're looking at kind of all the typical stuff, but are you also looking for symptoms of hot and cold or sort of those
Totally.
Chinese things? And which that's pretty much all I know about that is
Yeah,
that.
meridian theory too. I mean, I think it's all important. Yeah, I should have mentioned that actually. I appreciate you bringing it up, because the physical stuff was also a really important part of my training, because not only did I get like double anatomy, but I got even extra anatomy, because all the acupuncture points are based on anatomical landmarks. So the space between points, the space between muscles, tendons, bones, whatever.
Yeah.
And so the process of examination, it's hard for me not to think that or to feel that now. So feeling the meridians, or looking at the meridians or whatever it may be. And yeah, and hot and cold is certainly a piece of that. So I'm always looking if their hands are cold or not. I'm always looking if they have blood pooling in their lower extremities, if they look in purple, or if they have poor venous return. I'm always looking at blood flow assessments, which I think have been really important and integral in the traditional Chinese medicine. But even just looking at their face, their constitution, what they call the shun, their spirit, so to speak, just seeing the person, there's a lot you can kind of see in the individual too. And those were very important principles that I think medicine's kind of long forgotten. Is even the art of what I call the art of the physical exam now. I mean, there's always more I can learn about physical examination. I'm by no means like a crazy expert on it, but I'd say that it's missed, and especially after in this post-COVID era.
Yeah.
A lot of times it's very abbreviated or not done at all. And I have nothing against virtual. I predominantly run a virtual practice, but I still see my patients whenever I can at a
Yeah.
regular interval.
Yeah.
So as quick as every 6 weeks, or maybe 3 months, or maybe twice a year. But in that time, it's incredibly integral. So yeah, the Chinese medicine really did help that too. I agree.
Yeah, I definitely seen how thoughtful your physical exams were, encouraged me to not cut so many corners on my physical exams. So again, I don't have that Chinese medicine background. I agree. It's good to get your hands on your patient, feel just kind of firmness of the tissue and see what's going on there. And when you're working in that complex chronic model, our expectation is that we're going to see shifts to those things as treatment progresses, right? So
Absolutely.
my example is on being on the IV side of things. What my thing was, I could tell when I'm starting IVs on folks, I could tell your Bartonella patients who were early in their treatment, right? Because they've got all that peripheral hypersensitivity. The needle is, or the cath is uncomfortable the whole time. And then we could see over the weeks and the months as they were treating, a calming down of those symptoms. And so I imagine, especially for you, those physicals and being able to track those symptoms that patients aren't necessarily reporting.
And I really have been trying my best to encourage patients to really journal, which I'll have to talk about more sometime, because a lot of the complex chronic world, there aren't really a lot of quick fixes for things. I mean, it's really nice when we get really big wins and stuff moves quickly, but that's the exception, not the rule, I guess I would say. And so you need to be able to objectively monitor these things too as a practitioner. But I'm also really wanting to encourage patients to journal their symptoms, because they may have gradual but significant changes over time. They may not remember all the time that the catheter was more sensitive. maybe they'll have a, recognition of it eventually. Oh yeah, just woke up someday.
A lot of times they don't. And I'll be
Yeah,
the one talking to them about it, right? I'll be like, oh, look, you tolerated that a lot better today. Or they'll kind of, oh, I guess, or right. So yeah,
totally.
interesting.
Yeah,
And I
so
love
the
that.
awareness piece and the mindfulness is really important too, and
Yeah,
it also helps us as practitioners. So,
yeah,
and it's not
yeah.
their fault, a lot of times it's just there's so many symptoms that wax and wane on a daily basis. There's brain fog,
Oh,
the nervous system sensitivities, or pain sensitization, and all kinds of things that are kind of going into this. So it's like I said to people, it's different degrees of feeling bad sometimes. So, but
yeah,
it's easy to forget some of these small progresses. So yeah, we'll
yeah,
talk about that again
absolutely.
sometime.
Yeah, I love that. Tell me how. I'm not at all surprised that you wound up in this highly complicated, complex chronic disease model, but was there anything that really specifically drew you to it? Or was it just that this is kind of where you got to explore the most medicine in a sense?
Yeah, it's a really good question. I think I didn't expect to necessarily fall into it, and there's a couple things to consider. For one, they will say sometimes that a certain type of patient may find you if you're a good fit for that patient, or if you're maybe a good constitution for that type of patient, or whatever it may be. And that even goes way back with the idea of the healer or the shaman, people finding you that are meant to find you for the support or help that they need. So there's that part about it. It's kind of like a calling, but also I have been really fortunate to have I joined a practice that was really treating complex chronic. It was a family medicine practice around 2015 or so. And that really kicked things off in a big way, because suddenly that was a place that I was encountering a high volume of those people,
Yeah,
versus maybe before I'd see one or two here and there or something like this. And I didn't necessarily have to, in that prior practice, get as deep with them, because maybe I was just dealing with a certain aspect of their care. Maybe I was their primary care physician because I was doing primary care prior to that, and in the state of Washington. So it was just a progression, I think, as I started to dive deeper into complex syndromes and just an individual's multi-systemic issues. More than one body system is not regulating correctly. It was just sort of a logical progression. And I think it's also been the drive to learn and understand, which I think you need to have that, because a lot of people get into this complex chronic world, but they don't last more than like 2 or 3 years. It's easy to burn out.
yeah,
You really have to want to do it. It's not something that you just do.
yeah.
At least I don't think so. And I've heard, other doctors, of course, in the conventional world say, well, you guys are just basically trying to take money from people or something. I was like, well, even if it was just about the money with people, it's not enough money to deal with the level of energy and care that you need. It's not like a cardiac surgeon or something.
I know, I know. Isn't that astonishing? I was so impressed when I first started working with you at how competent you were with how many different systems, right? And I think you have to be, when, just like you're saying, you are truly treating the whole person, but you have to be really good with your endocrine, and you have to be really good with your autoimmune stuff, and really good with your gut. And you have to have all of sort of like kind of everything down as a foundation, and then add in the infections. And the infections are still so complicated to me. I know that if that's what I was focusing on, I could get the hang of it. But just, from an outsider's viewpoint, it's like you have to be a specialist in every field in order to do what you do. Yeah.
Yeah,
So
and I think that's the foundation of the idealism of general practitioners or primary care physicians. If
yeah,
they had that skill set with all these different things, then they could see the interconnectedness between the different systems at a base
yeah,
level, and then they could
yeah,
really truly determine when sending to that super mega specialist was necessary or not.
right,
And
right.
so, but in the complex chronic world, you have to be that, because unfortunately,
Oh yeah, you have to specialize in connective tissue disorders
yeah,
and whole
I
mold
had to
all of a
learn a
sudden,
bunch about collagen
environmental,
disorders
and
and
it's like, yeah,
instability syndromes and Ehlers-Danlos and all kinds of stuff that I never thought I would necessarily have to know that much about. And so
Yeah,
there's kind of a new idea every day, it seems, or every couple months, with things I have to learn more about to really understand. So it is a building process. You're
yeah,
not really expected to just learn everything overnight, but if you're competent enough in each of those systems, you can decide when you can determine better when it is necessary to send them on for higher interventional strategies,
yeah.
drugs or surgery, or referral process and all that kind of thing. But you can better core manage their entire case as you understand where the interconnectedness is, because most of those specialists don't talk to each other very much, unfortunately. I've tried to
Absolutely.
really mediate these discussions with some of my patients too, with their practitioners. I do a lot of peer-to-peer and stuff like that too.
Yeah,
And that's
yeah,
that's actually really insightful. If you get the right person who's fairly open-minded, you can learn a bunch from them too and
yeah.
really figure it out. So yeah, it's an interesting process. There needs to be a change in general practice, I think. And I do see some systems really trying to do it, but they don't really go to the depth that they need to go in learning these systems better. So it's something we've had to largely learn ourselves or through our great mentors, so to speak.
I totally agree. I feel like I personally, everything I know that I use that is really actually useful for my practice, I learned after medical school. I mean, I learned the basics there, but I feel like everything I do, it like I had to seek this out. I had to go to the trainings. I see your continued thirst for staying as current as we can. It's funny, that just reminded me of, I saw it was a silly clickbait headline recently, but it was basically like, the question was, who is the more effective physician, younger docs or older docs in practice? It was just posed as this polar question. And
Yeah,
you open it, right? And they're like, well, doesn't matter. What matters is who sees the most patients and who stays the most up to date with what's going on in their fields and the fields around them. Right. And
totally.
it's like, so you're kind of like, well, duh, guys. But
Of
thank you.
course.
Thank you for
Yeah.
doing that. Like,
And there is such a thing as wisdom. So old docs,
yeah,
gain wisdom and through experience and practice. And that's very important, but they
yeah,
also have to continue to have the drive to learn. And they have to be willing to change their
yeah,
models, their
yeah,
paradigm. And we're going to talk a lot about the concept of paradigm at a later date here.
yes, yes,
But that's something that gets very stuck. And that's if that older doc is not stuck in that, and they're willing to sort of change their mindset and how they practice, how they see cases,
yeah,
yeah. So it doesn't necessarily matter. I get said, I'm too young all the time, of course. And some people prefer young doctors because they're more open-minded too. So it's
yeah.
lovely push and pull. The age doesn't matter necessarily. The level of experience can to some degree, but that has to do with the wisdom learned. But the attitude and the mindset is really what's most important. That's really what you have to evaluate from your practitioner, old, young, in between, male,
Agreed.
female,
Agreed.
anything.
And I I found personally, I think it's really important for patients to feel like they have a good relationship with me. That therapeutic value I'm specifically looking for. So if a patient doesn't really resonate with me, or we kind of don't really get along, which happens every now and then, I mean, it's not super frequent, but I have had folks where we just rubbed each other the wrong way.
Yeah.
In that alone, I was like, I think we should find other folks to work with, because there should be value here. I mean, we have the studies on it that patients do better when they feel that their provider is personally invested in their well-being. And
Yeah.
that's something I definitely see you bring to your folks. And I think it's one of those, it's not necessary for the doctor-physician relationship, but gosh darn, it goes so far in terms of
Yeah.
making that connection in which, we're able to encourage that healing to occur. So
Yeah. One of my instructors in Bastyr used to say to us every day, and this was even in first year, he'd say, "You are the medicine," and it's true. There's a certain amount of you that is the therapeutic has the therapeutic value of the whole process. It's not just you entirely, but it's you and them. It's kind of a collaboration,
it is.
and it's really quite powerful. And most of these people are coming with immense amounts of accumulated trauma, not just like childhood trauma or ancestral
Yes,
trauma and all these things, but medical trauma
yes,
especially. And you have to kind of be able to navigate through that to a degree. And part of that is that they will know if you care, if you're attentive, if it's really something that's important to you or not. I mean, people can see right through you at that point, you know. So that's why I said it's another aspect, I think, or I personally believe, that you have to really want to do this type of medicine. And I've certainly had people that aren't a good fit too, and that's why collaboration with our colleagues is very important.
Right?
Like Lauren, like Dr. Mathewson here,
Yeah.
and others. I mean, we're talking about a collaboration, and that's really going to be the theme of a lot of our, you know, discussions in this
Yeah.
podcast going forward.
Yeah, absolutely. I so agree. Stepping back, what do you think, kind of when we're just looking at what's going on, our current state of medicine? I see conventional medicine as being kind of a hot dumpster fire in a lot of different areas. What are your biggest concerns with them for the next 15 or so years? Like, where, you know, what if you could make some interventions in the conventional medical model, you know, you had a wish list, what would you aim for?
Oh, it's so hard when there's so much money involved. I think that at the core of this, and not to try to be too crazy here, but like anytime you have this for-profit system, there's just so many conflicting interests. And I think that that's one of the biggest problems here. And I'm not saying that, you know, through idealism, we could say that, well, maybe if we just socialize the whole thing, that that would be better. And that's a whole topic in and of itself. And maybe we'll talk about that sometime.
Yeah,
So it's kind of a tough game, but as long as it's a for-profit system, it's it's not always going to be working in the best interest of the patients. And though there is an acknowledgement that complex chronic disease is on the rise, I feel like it's going to take a while for, once again, these medical paradigms, these ways that they're thinking about it, to change effectively. Because I talked to my Kaiser doc, for example, and they said, you know, in Oregon here, we really need naturopaths because there's a lot of demand for that, for example. And I was like really surprised because that was completely opposite of what I heard in California in the Sacramento area from similar Kaiser docs, right?
yeah,
Like they were threatened by us or whatever. But the people that have kind of come to the recognition that there's a really big drive for people seeking natural medicine, and that response is really to the inadequacy of care that they get, you know, that there isn't enough appropriated prevention medicine. People don't talk as much or effectively about diet and lifestyle interventions. Even the conventional nutrition programs are archaic, you know, half the time.
yeah,
It's that people just see that it's not working for them, that
yeah.
everybody knows somebody with a complex disease now, a complex chronic disease. It's almost everybody knows somebody,
Mhm.
whether it was post-COVID or whether it was Lyme or whether it was, you know, something else, even cancer or something, right?
Yeah, yes,
So everybody knows someone. So it's just, I think the people are coming to a recognition that there needs to be a change. But once again, I'm concerned because as long as it's a for-profit system, they're going to try to find ways to continue the profits, but to sort of appease to that
yeah,
group. So they've hired some functional medicine doctors, but they haven't really fully integrated them all the time. In fact, they've kind of broken down some of their integration, like in the Sacramento area, even like I won't name, you know, the hospital system, but they were hiring people and then they fired people. And when the people that they did hire, they only had them as consults. They didn't have all the rights and privileges of the other doctors. And so they were just being treated like second class citizens, but they wanted to cash in on the demand that was out there. So until a bigger picture is seen, and I don't know what that's going to take, some sort of authority or, you know, think tank of people to actually, from different parts of the conversation. And I certainly don't think NDs have yet a seat at the table. You know, we're still the second class citizen, but there are functional medicine doctors, DOs, MDs, and even chiropractors honestly have more recognition in some cases that are coming to the table. And I think that in that case, there may be hope for change. So I'm a little concerned because they're eroding our profession, taking away our therapies, and then turning around and turning them into drugs, for example, like what they just did with phenylbutyrate for an ALS drug, for example. And they're doing that they did that with artemisinin, which
Destiny,
is
yeah,
derived from wormwood, you know. So they're doing that with a lot of things, and you can kind of see that it's blatant. So I'm really concerned about access to a lot of this, that not everything's covered by insurance. A lot of us have been sort of forced into cash modeling as a result of that. In
yeah,
California, we have no choice. There's no insurance coverage whatsoever for NDs. And our therapies are being sort of taken away from us at the same time. So you just have this sort of dichotomy here where there's such a high demand for what we do, but it's threatening the profits of the system, and so they're pushing back against us.
Yeah.
So first they ignore you, then they fight you, and then you win. Is that like the
And
paraphrase?
then I think they just fold you in, they assimilate you, right? You just,
Yeah, or they try to assimilate you, right?
and
They
then
try
you
to
go
form you.
extinct. Yeah.
Yeah. It's, that's what they were trying to do, because these systems are also hiring NDs as part of the hospital systems, but with a short leash. And nothing
That's,
against those people that are working there. I mean, I have nothing but
yeah,
respect for you. If any of you
yeah,
are listening to this at
yeah,
all, I respect you guys working from the inside. I think it's a very important position. I've applied for those positions before too. Where
yeah.
I'm at right now, it's probably not for me, but I appreciate the NDs and the innovators, the DOs, the MDs, the DCs, the NPs, everybody that's
Oh,
out there
yeah,
trying to, from inside, trying to work this through.
100%. And exactly kind of along parallel with that, what do you see as being the biggest challenges presenting to our field, to naturopathic medicine over the next handful of years?
Yeah, well, we're fighting a lot right now. I guess we always do a little bit, which
Yeah,
it really frustrates me for a lot of reasons, because there really aren't very many of us to begin with. And so we really shouldn't be fighting amongst ourselves. It's kind of a thing where if we could unite on certain really core principles, which I think we can if we actually just
yeah,
got together. And maybe if we actually got together face to face too. I mean, that's why I've been trying to go to more naturopathic, gatherings. I went to the CNDA this year. I was going to go to
yeah,
the AANP, and then it was happening right now, I guess. So I missed it. That's the National Association of Naturopathic Physicians. I think for one, a challenge in our profession is that we aren't exactly on a united front right now. So I think that could be a really big issue going forward. We're kind of divided between, I'm more traditional, you're more integrative, and that's not necessarily a bad thing. It's okay that people are operating, differently and on that spectrum and that plane. It's important to kind of be working in those areas to try to expand our scope of practice and to get more states. And it is important to get insurance coverage. Some people have elected to operate in cash practice, and they've done that for the most part because there isn't insurance parity, and the therapies that we do are not covered by insurance, or we don't have an insurance option in the case of California. So access is really a big deal for naturopathic medicine. I think you could throw a rock and hit an ND, but whether you can afford or access that ND for sure is a challenge still.
yeah,
So I think, like I said, we need to have a united front. We need to work with the legislation, with the lobbying, or whatever we need to do, to try to get our scope of practice expanded so that what we've been trained in is actually able to be covered by law appropriately. And we need to get better access to the medicine. And if we can do those things, I think we'll be able to recruit more people into this field too, because I'm concerned about the numbers of people still entering the system, and some of the schools have been struggling. Two of them are merging right now. That comes from financial struggles, probably related to the pandemic to some degree.
yeah,
But we're not getting enough people into the field that I think, and I'm not saying there aren't people that are going to change it that aren't amazing thought leaders or will be, so to speak. It's just that I think there's always power in numbers here. If you can see kind of how the chiropractors and the DOs and everybody else sort of operated and changed. So I see a lot of challenges there, as mentioned, and I think I could probably break it down to those things. Not really a united front, not really optimal access, and then not really optimal scope of practice across the United States.
yeah,
So even though we're in very high demand, if we don't fulfill these things effectively, we're not going to be available anyway,
yeah,
or only
yeah,
to a very small group of people.
yeah. I agree. And in so many ways, I see that in my own practice, and that what we do by financial necessity is almost boutique medicine. And I wish it was not that way. I wish it was available so much more broadly, because, aside from kind of our fancy footwork and our high level protocols, a lot of our stuff is so foundational. It's eating well, it's stress management, it's, things that are applicable to everybody, not just folks that can afford to pay out of pocket. So I absolutely agree with you.
Just one more thing I'll say on that. I do largely consider you and I more on the specialist plane of this whole discussion, and that comes with its issues too, because the amount of time, energy, and everything else that we put into this, I've tried, it doesn't work in an insurance model as it stands, even in the
Yeah.
states that are able to.
Yeah.
And if we were actually compensated appropriately as specialists, like a specialist would be, it wouldn't necessarily be as big of a problem to retain, that access point.
Yeah.
So unfortunately, it has been sort of self-preservation for us to have to adapt and change to the systems, because it's really a systemic issue. It's
Yeah.
not like you and I are just deciding that, hey, we're going to make more money doing this or something. It's just a response to the issues within the system at large.
Agree. That is something that's really interesting. I know that in my own practice, because I do see so many oncology patients, it's heavy. I lose patients, and it's part of being in this field. It breaks my heart every time. I never get used to it. I have to do a lot of intentional self-care stuff to kind of make sure that I stay grounded. What do you do? Because I know that you see, you're in that same heavy space with folks, and I know that on occasion you lose patients and it is just as devastating. And kind of, how do you take care of you in the midst of all of this?
Yeah, it's a work in progress. I don't know if I could completely write the book on it right now. I'm always working on it, because there's hard times where I don't, feel like I have as much of a grasp on it, and then there are times when I feel like I have done enough self-care or whatever it may be. So I really try to intention to give myself the space to, well, first of all, not overwork. So, really try to recognize the number of hours I'm putting in on a daily basis, and, be okay stopping at a certain time or not continuing that. I came up to Oregon so I could get some land. I think it's really important to me to connect with nature, to be outside.
Yeah.
We have a little mini farm. We have, some animals and stuff like that I can talk about sometimes, and places for my kids to run around and play, a little tree house and stuff. So I can even look out my window and feel like a sense of calm too, rather than being in a city for me. It's not just like where I am in my life. So my environment is incredibly important and integral.
Yeah.
And then foundations of health, eating healthy, sleeping well. It's all very important. I've come to this true recognition that I almost have to be attentive to those things, or else nothing else works. That I've really done a lot of working on my diet, and really eating healthy. And even when you're stressed, it's easy to stress eat or do things just to have more discipline in that environment, and it's really made a difference for me personally. And exercise, movement, and just all of it. So you have to keep your body healthy, you have to keep your mind healthy, you have to have other hobbies. Like you can see, music stuff back there for me, for example. Reading about other more interesting things, or maybe just even reading, fiction or something, or whatever, reading about history, nature, other things. You gotta find other interests too, to get your mind into other spaces, and that'll help a lot. As I said, I don't know if I've quite mastered it yet in this game, because this is pretty intensive work, as you know, but it's a work in progress. And just like you're learning at large about how to help people the best, you're learning how to help yourself too through this process. A
Yeah.
lot of my patients teach me how to better help myself. And maybe it's just looking in the mirror and saying the same thing to yourself that you said to them.
Right.
That may be the easiest thing to do.
Yeah.
Or maybe a recognition, a realization that they had, and you're like, wow, that might actually apply to me too. Maybe I should have thought about that. Uh, the doctors make the worst patients, they say, right?
Oh, yes.
And
Yeah.
treating yourself is not advised.
Oh, I am a terrible patient. I self-doctor. I'm the worst.
Oh, we're
Everyone
guilty.
can
We're all
attest to
guilty
it.
of it. Mhm.
I had a big funny recently. I was our medical assistant in the clinic in Fair Oaks. We were talking about what a terrible non-compliant patient I was, and I made a joke about, what do you think the Venn diagram of talented doctor versus terrible patient looks like? And she goes, I don't even think there's a diagram. That's just a circle. There's just a full overlap. The better you all are, the worse. So
Yeah, I can see that.
I know. Yeah. Oh gosh, I love that. Jamie, I agree with you. For me, it's about just kind of finding things that keep me grounded. And it's just, and those hobbies kind of will shift, or those interests, but it's about being able to step back and take a breath and come back into my current present, my current body, and where I am. And I find I am the most effective with patients when worked on myself so that I can stay grounded for me and for them. Because some, it's no good for them if they're coming in and I'm already in a heightened state, or I'm preoccupied, or I feel like we said, with what you and I do, it is high level such that I don't think people should be dabbling in our fields.
Yeah.
I think if you're practicing and you're seeing Lyme patients, that should be pretty much mostly of what you're seeing. Same with oncology. I don't want folks to see practitioners that see a bunch of general care and they've got 1 or 2 cancer patients. It's like, our patients deserve that full focus. So
yeah, no, I would tend to agree. And I mean, I appreciate people trying to fill the gaps of care, like I said, because there are access issues and everything. But
yes.
yeah, it's that's where we're trying to kind of establish a better collaborative place in our profession at large. And I'll do consults with docs too, and just try to give them some guidance. And if it's too crazy, then they can always come to me or to one of my colleagues, of course. But but I agree with you. Otherwise, it's not necessarily a field of dabbles. It's a little bit more than that. And just like any other specialist, that's what I try to frame this as. Really, is this is all specialty care.
Yeah.
So you wouldn't necessarily do all the work a cardiologist would be doing if there was a heart issue, right?
Yeah.
But you can collaborate with them, of course, and you can learn from them, and you can integrate some of those things on a local level.
Absolutely.
But you want to have somebody that's really dedicated. I agree.
Yeah. Yeah. What are you looking forward to? Is there anything that you're excited about?
Yeah, there's always a lot of things I'm excited about. I think that just the learning process excites me in general. Like right now, I'm doing deeper dives into studying mitochondrial dysfunction, for example, and I think that that's really exciting me. I've had a few wins there using some peptide combinations and different things for chronic fatigue, and I feel like I'm close to understanding some of the depths of that discussion as it relates to my chronic patients, because most of them have some sort of mitochondrial disorder, and some of them may have genetic issues, and a lot of times it's the epigenetic factors, the infections and the toxins and everything else that hits them. And even cancer is a progression of mitochondrial dysfunction, the loss of programmed cell death and the disruption of the metabolic process. We'll talk about this for sure in future podcasts. I think it's really interesting. So that stuff is really exciting to me, of course. Always learning about the peptide therapies too, which are really exciting for me. And there's some other endeavors that I'm doing right now that I'm not going to discuss at the moment, because I'll wait and leave you all in suspense. But I'm always doing a few things behind the scenes that are going to bust out in the future, I think, in terms of integration into my practice. So I'll leave you all in suspense on that too. But let's just say there's at least one more thing or more that's very exciting to me right now.
Oh, Jamie, I love it. I love it. You are leaving me in suspense. I am going to be thinking about what you could possibly be up to.
Oh yeah, always up to something.
Is there anything sort of about this current time era and this current generation? I know you've got some young kids and they're amazing and they're incredible. And we are living through this sort of real-time climate collapse disaster. Is there anything about your kids being born in this generation that you're really thankful for, or that you think they really have an advantage that we didn't have?
Yeah, I don't like to dwell on the negative stuff if I can help it, because there's plenty of things I'm still frustrated at. But I have to remind myself sometimes that we're sort of in a transition as a society, as a country, probably the world, honestly, if you're really talking about the bigger threats of, like, say, climate changes and stuff like this. And I think that for my kids, I'm somewhat encouraged about sort of how do I say, it's sort of the changes in socialization. I think it's just recognitions. I want them to still be able to socialize face to face, which is something that's challenging sometimes since the pandemic, for sure. But it's just how people sort of talk to each other, talk about things. There's more of recognition of, like, systemic racism, and there's more of a recognition of identity than ever before. And I actually do think, as hard of a transition as that is, because we all remember sort of how it was different whenever we were kids or younger, as hard as of a transition that it is, it shouldn't be, it's going to be better in the long term, I think. And the less we shame ourselves and shame others through that process, the better. So if I can sort of teach them to roll with it and avoid the shame, that they are sort of in a transitional society as it stands right now, and stay off social media. I'll complain about social media a lot. Uh, if they can really connect with humans face to face in person, and really see them, empathize with them, feel them, understand them, and know how to, sort of talk to them and ask the right questions, I think that maybe society could be saved. But so I'll elaborate on that later, because that means a lot of things. And there's so many buzzwords and crazy things that are out there right now, and it's hard to talk about all that stuff, I have to say. But
I agree.
as hard as it all is, I think at the end of the day, I'm encouraged and optimistic.
I absolutely agree with you. And I feel very similarly about this sort of younger generation. They're just being sort of more open-minded and more forgiving with one another. And they're just sort of letting one another have a little more truth and honesty in their expression of who they are. And I think our society is having growing pains with it, but I am really encouraged by it. I think it is probably very much having to do with how interconnected we all are on social media and the interwebs and all that sort of thing. But I think that's one area where it's sort of normalized that it's okay to not necessarily fit this traditional mold that you were given. And so I love that too for
Yeah, and
our,
I think social media may be a double-edged sword, honestly. I probably hate on it a little bit too much, but
yeah,
I think it's probably allowed for some of the a broader exchange of information, and it's maybe connected certain people to other people that are more like them that they wouldn't have
yeah,
otherwise encountered.
yeah,
So
exactly. Yeah,
there's
yeah,
positive and negatives. I think we could dedicate a whole segment to social media, honestly, because it really does relate to health in so many ways. And
indeed.
I need to challenge myself to not have a bias towards it all the time, because
Yeah,
I do have a bias towards it, of course, because
yeah.
there's negatives about it that I think have been really detrimental or harmful.
I think it's
But
at this point, I think it's been around long enough that we all are very cognizant of the negatives, right? It's like, oh,
absolutely,
social media is damaging our mental emotional well-being of our youth. And the longer folks are on, these specific websites, the higher their rates of anxiety and depression and self-consciousness and blah, blah, blah. So we have all those studies. We all super know that. But I agree with you. I think there is a way to navigate and find the strength and the benefit in there without being too Pollyanna-ish about all of it, but also knowing that social media is not going away.
yeah, that's
And
it. I mean, the
yeah,
embracing of technology is not an easy thing. I mean, we'll have
yeah,
to talk about AI sometime too, because
yeah,
AI, artificial intelligence, is really going to affect medicine for the future, and it's going to
I know.
affect us in some way. And
Yeah,
there are ways that it might be good for us, and there are ways that it might be not so good for us.
indeed.
So
Indeed.
yeah, technology is something that we can't really just get away from. I mean, we could try to go buy 200 acres of land and live off the land and be off the grid and have a commune, but it's not.
The truth is, I only want to milk goats for like a week and then I'm over it, right? I'm just done, right? I'm like, okay, I'm ready to have my my city water system back, please. And my
Yeah, no, totally. I
yeah,
know it's
I know.
not realistic for everybody.
Yeah,
It's important to hold on to those roots and to connect with nature
yeah,
for
yeah,
us. But that doesn't mean that that's going to be the solution to
yeah,
to
yeah.
our concerns and fears around technology. So
Yeah, indeed. That's so interesting. I'm excited to talk more about AI with you. I want to dig in on that. I have a lot of thoughts and apprehensions and all the so that'll be a really exciting subject for us to cover.
yeah, see, we already made a whole bunch of different podcast topics just in this one
Yeah.
interview. So just you guys wait. It's gonna be fun.
And this is so broad and it can be as broad or as narrow as you want, but just kind of in the whole scheme of things, when you think about it, is there any specific way that you would like to be remembered for your contributions or for, what does that look like?
Yeah, that's a good question. I mean, I guess it relates to how I want to be remembered as a physician, and maybe how I want to be remembered as a father, as a person. There's a lot of different nuances to that question, possibly, but I'll kind of speak at least to sort of as a physician or as a healer. I do want to, I guess I want to be remembered as somebody that, does care, that, really is passionate about the medicine, about the process, somebody who, wants to learn, somebody who is humble, not past humility or being self-critical or anything like this, not an ego, so to speak. And I think, there's arguments for why we need some of that stuff too, I think, and to be effective leaders and to have confidence and all that. So I'm not talking about knocking myself down, just really to feel that people understand that I have good intentions, or I am an intentional person, intentional caring person. That's kind of what, and it's I guess it's only important to me because that's how I feel, I guess.
Yeah.
And it's hard to really know what the intentions of an individual are at any given time, and their actions hopefully speak louder than their words, because you can say anything you want, technically. So I'm just saying this right now.
Yeah.
But is it really relatable to my actions or what I accomplished or what I did? And that's, hopefully in the memories of those that have met me, or in other unforeseen media or broadcasts. I have no idea. We'll see. I do want to get into doing more teaching at conferences and different things. I really did enjoy teaching the residents at the practice that we worked at together.
I know.
I love to be able to get into that collaborative and teaching space. So that's something I'm really working on right now.
That's wonderful. I love that. I love that. Me too. I'm begging my clinic to, will they please get me a resident one of these years? I finally got my puppy and now I'm begging for a resident, and then everything will be dialed in.
Right, totally. I know. Puppy and a resident.
Because I agree with you that the educational piece and the being able to share what I've learned and what I've known is such a wonderful kind of full circle for me being in medicine. So, and you are such a wonderful, talented teacher, and I saw our residents just really bloom and blossom under you.
Yeah, I'm very impressed with our residents. I mean, really,
amazing.
They're doing awesome.
I'm proud. Like
we'll get them on here sometime. Don't worry.
Let's bring all of them on. I'm so excited. Each and every one of them I am proud of in their own unique ways, and they're all just thriving, and what wonderful, wonderful humans. Yeah. So we made so many amazing connections at that clinic we worked at together.
Absolutely.
Yeah.
Absolutely.
Yeah.
No, I mean, that's why we're still talking together. It was a beautiful space.
It was. We had our challenges and we persevered.
We did.
And we're all on the other side. So yeah. Oh, Jamie, thank you so much. I have loved every second of this. I am so grateful, and I'm so excited about our future conversations. Like I said, I just really love sharing ideas with you. And I love seeing how your brain kind of interprets things and rolls them around. And it's so rewarding for me to be able to kind of dig in on things and get your take. So
yeah, it's been a pleasure. And next week I'll interview you, and some difficult questions. No, I've really enjoyed this experience. I'm looking forward to this. This is going to be really fun.
Awesome. Cool.